Hey guys, Lori here, pharmacist. So I was going to talk to you today about a video I came across last night, actually by an MD, and it was regarding a man who died of the Covid-19 virus, the coronavirus, over in China, and his autopsy results. But before I do that, I want to thank those of you who responded so generously and gave to me as a result of my last video. This is my only source of income right now. I am working to get some other things going, but because of my stance, because of speaking out, trying to find a job, and honestly, the jobs in pharmacy these days are so horrible. Not only would I be contributing to the demise of you all, of people, because this healthcare system is not about healthcare, I would also be miserable. And I just don't feel like that's what God has. That's not what He's telling me. So I have answered your questions faithfully for the last 2 years since I started making videos and asked nothing in return. So what I'm asking now is for some help financially. So I can continue to do this full-time or almost full-time and continue to pour into you all, continue to give you really sound advice so you can make the best decisions for your family, for your children, whatever, for their health as a mainstream medical professional. I am, again, asking for recurring payments would be the best thing for me, but whatever you can give, whatever God puts on your heart. It's thewisepharmacist.com, and there is a donate button on my website. So thank you again. The other thing I'm set up to do and want to do and have started doing is consults. Doing medication therapy management, true medication therapy management consults. If you are interested in improving and reversing disease, want to get off some of your meds or know what meds you could possibly get off, I'm here to help you because my heart was broken when I was doing medication therapy management back last year and talking to people all over the US and how, oh my gosh, just laden with prescription drugs people are, because it seems like most doctors know how to do unless they've gone integrative or functional or chiropractor. Well, chiropractors don't prescribe drugs, I guess, but you know what I'm saying. But mainstream doctors, it's drugs, drugs, drugs. And that's exactly what happened to this guy that I want to talk to you about. So again, I'm open for consults. You can contact me on my page, thewisepharmacist.com, or you can shoot me an email if you want, thewisepharmacist@gmail.com. Moving right along. So this guy, 50 years old in China, day one, wasn't that bad off. As a matter of fact, the guy wasn't that bad off until he hit day 21. And that's when he decided to seek medical help, judging from what was on the video. At that point, the virus had progressed and he had like some respiratory issues. He was having fever, chills, that kind of thing. So he sought medical help. And I think that's where he went wrong, okay? I'm not lying. They put him on 5 different drugs, with the last one being a fever reducer, probably Tylenol. But the first drug they gave him was called interferon alpha 2B. Okay. The second drug they gave him, which is actually a combination of 2 drugs, was called Kaletra. A combination of 2 antivirals. And I will put a link so that if you want to watch this and see what I'm talking about, from this doctor, but gave him 2 antivirals. Interestingly enough, this drug is for HIV positive patients. So HIV drugs in general have horrific side effects. I have always just felt really sorry for anybody HIV positive that they got on any of these drugs, because they're bad news in the side effect department. They wreak havoc on your body. Moxifloxacin, they put him on, which is an antibiotic. Interesting, because he presented with a viral infection, but they threw an antibiotic in the mix too. Moxifloxacin is a pretty big gun. It is a first cousin to Cipra. So that means it's a fluoroquinolone. If you don't know, fluoroquinolones are notorious, even though they're prescribed like water, because apparently The medical society has not gotten the memo of how much damage these drugs can do, but some people have been maimed permanently, particularly tendon rupture, tendon damage, and permanently and irreversibly, sadly. So they put him on that too. Then they put him on methylprednisolone, which is a steroid. This guy had COVID, died of COVID-19, but he also had the acute respiratory distress going on. So I could see the steroid for helping reduce inflammation in the bronchioles so that he could breathe better. That makes sense. Then they gave him a fever reducer like Tylenol. Interferon alpha 2B, one of the side effects is trouble breathing. Great. And he actually developed the acute respiratory distress in the hospital, okay? He didn't show up at the hospital at death's door. It just went from bad to worse to dead, okay? The Kaletra, the HIV positive medicine, can cause elevated liver enzymes. It can cause decreased white blood cell count. Can also cause cardiac issues. The moxifloxacin can also cause cardiac issues. So he had 2 drugs on board that can cause cardiac issues. And lo and behold, when they did his autopsy results, came back with elevated liver enzymes, came back with low white blood cell count, and ultimately he died of cardiac arrest. So when I saw all these drugs this poor man had been put on and the severity of them, I'm going, how can we say that he died of COVID-19? I mean, let's just say, when you look at the side effect profile of all these drugs and what the man had going on, that the drugs didn't kill him. Yesterday I posted, and I'm going to repost something a little more alerting, but number 4 leading cause of death in the U.S., and I'm thinking maybe China too, although it may be higher in China, judging from this protocol, is adverse drug reactions, you know? Number 4 killer. Number 3 leading cause of death in the U.S. is medical error. So we're doing great, guys. We're doing just great in this not so healthcare system. Anyway, I just want to bring your attention to this. I will repost the video so that you can watch if you want. And you know, the other thing that hit me was, here you read the headlines and you know how they do this. They COVID, you know, deaths from COVID or deaths from pneumonia or deaths from influenza. And unless you know what was going on with these people, A, before they ever entered the hospital, but second of all, you know, they want to, if you can't believe the headlines, is what I'm trying to say. You know, you've got so many other variable factors. What prescriptions were they on? What was their therapy? Healthcare in this time, in this era, is literally among the leading causes of death. And the drug therapies that they're using are the leading causes of death. I mean, you gotta be so vigilant. And I'll tell you this too. Been reading articles, not like I didn't know, but it's like maybe it's starting to come to light about the large drug chains, particularly like CVS, Walgreens, but this is true with the grocery store pharmacies, any kind of chain where the pharmacists are being given so limited help, and it's actually putting the public in danger. So if you're getting prescriptions filled, any kind of chain, well, really anywhere, you need to be paying attention to what the sheet is that they gave you, what the side effects are, making sure you got the right drug in the bottle, because people are dying and being permanently maimed because pharmacists don't have enough help. They're not giving them breaks. They're trying to get blood out of a turnip, and you know, you can only do so much, and the people are the ones that suffer the consequences. So just a little aside there, but that's the deal, guys. So love you guys, love your questions, glad to help. Again, it's thewisepharmacist.com. There's a donate button there on the website, and I appreciate any help you can give me. That would be outstanding. Thank you so much. All right, talk soon.